Hi, my name is Beth from Dr. Dominic Mazzacco's office in Hanover, Massachusetts. The purpose of this video is to review instructions and care of your palate expander. First of all, the palate expander is custom fit to your mouth, and it fits across your palate just like that, with the molar bands seated around the molars. When you turn the palate expander, we're going to instruct you to turn it once every other day. We'll have you mark a calendar or put it in your phone so that you always know when you've turned it last. If you've ever missed a turn, we don't want you to do 2 turns. We just want you to continue with your 1 turn every other day. When you turn the palate expander, there are holes in the palate expander for the key to fit into. What you want to do is you want to insert the key into the hole like this. And then you're going to give it a push to the back of the mouth all the way until it stops on the bar. I'm going to take this off of the model. It's a little easier to turn when it's not in a model. And I'm going to show you that again. So it's going to go into the hole like this, and then you're going to give it a push to the back. Okay? When you're done with the turn, you're going to take it out in the back of the mouth so that you don't undo the turn that you've just completed. As the palate expander turns, these 2 bars on either side here, you'll start to see them separating. I have a one that we've actually used, and you can see how it has expanded. You'll notice the difference in one that's been expanded a few times, how it's moved apart. You'll turn it once every other day till you see us again at the next visit. During the process, the patient will feel pressure on their molars, maybe even on their jaw a little bit, and sometimes they feel it on the roof of their mouth and on the bridge of their nose, and that's just because all those bones are kind of pushing on each other. The pressure will go away in 5 to 10 minutes, and sometimes the patient will have a little soreness on their molars, on the roof of their mouth, and even underneath their nose. If that's the case, a little Advil or Tylenol should be fine, and it shouldn't be anything that's unbearable for them. The care of the palate expander needs to be brushed every time you brush your teeth. So you brush your teeth normally, but also we want you to take your toothbrush. Let's put this back in. And you're going to go right across the roof of your mouth like this, making sure that you get anything that might be caught in and around it off. And you want to do around the molar bands as well to make sure those get nice and clean. We're also going to give you this small interdental brush that'll be great for getting anything that's stuck up on top of your palate expander. So you can use this to get in and around the bars. Okay. We want you to definitely stay away from anything sticky or chewy, like gum or sticky chewy candy, because that can loosen these molar bands, and then the palate expander will come out. We need it to stay in for 6 months after you stop turning it. So the duration of the palate expander is usually, we like to tell you, 9 to 12 months that you will have it in. That the whole time you won't be turning it, you'll be turning it for the first maybe 3 months or so, maybe a little bit more, maybe a little less. And then after that, it'll just sit and hold everything in place for another 6 months. Also, these molar bands, sometimes they can cause a little irritation on the outside of your cheek, so we recommend a little bit of orthodontic wax. You can take this, soften it up between your fingers, put it over the band, and just give it a little press on there like that. That'll make it a little bit more comfortable. You can pick this off with your fingertips or brush it with your toothbrush when you're done with it. Again, you don't have to use this, but it's there. I'm going to give it to you just in case so that it should be more comfortable. When you come in, you're going to get a chance to turn the palate expander before you leave, so in case you have any questions, you can ask them then. We also suggest that when you have the palate expander in, you speak slowly and talk a lot for the first few days. That way you can get used to talking with it in. A lot of people will have a little slurring of speech in the beginning just because their tongue doesn't know where to go. But then that should go away after with some practice. The other thing that can happen is sometimes from swallowing, if your tongue presses against the palate expander, you can get like a little imprint or a little sore on your tongue. Again, warm salt water rinses will be fine, and that will go away in a few days. If you have any questions during the whole process or at the after you've left the office about the palate expander or the turns, please don't hesitate to call us. Thanks for listening. Have a nice day.